Preventive health screenings are one of the most effective ways to maintain long-term well-being. These tests are designed to detect health problems early, often before symptoms appear. Depending on your age, different conditions become more likely, and skipping important screenings could mean missing the chance to treat issues while they're still manageable. Understanding which tests are most critical at each stage of life can help you stay ahead of potential health problems. In your 20s, health may seem like a given, but this is the time to establish healthy habits and begin routine screenings. Sexually transmitted infections, STIs, like chlamydia, gonorrhea, and HIV should be checked regularly if you're sexually active. Women should begin cervical cancer screenings with a pap smear starting at age 21, repeating every 3 years if results are normal. While blood pressure might seem like an older person's concern, hypertension often starts early and can go unnoticed, so testing at least every 2 years is recommended. A baseline cholesterol check is advised once between 17 and 21 years of age, and earlier or more frequent tests may be needed if there's a family history of heart disease. For some individuals with risk factors such as obesity or a sedentary lifestyle, early screening for type 2 diabetes could be appropriate. When you enter your 30s, it's important to stay consistent with the screenings established in your 20s. Women should continue pap smears and discuss with their doctors about when to start HPV testing. STI screenings should continue based on lifestyle and risk. If pregnancy is a consideration, preconception counseling and screenings for genetic conditions may be suggested. Skin checks become more important, especially for those with a history of sun exposure or indoor tanning. Look for new or changing moles and report them promptly. Mental health screenings, including for depression and anxiety, should also be discussed during regular checkups, as emotional well-being plays a huge role in overall health. In your 40s, new screenings are typically added to your routine. Mammograms to detect breast cancer generally begin at age 40, though some women at higher risk may start earlier. Colorectal cancer screening is often introduced around age 45, typically with stool-based tests or colonoscopy. These tests are critical for detecting polyps or early cancer before symptoms develop. Eye exams become more important in this decade, not only for vision changes but also to check for conditions like glaucoma. Type 2 diabetes screening becomes more frequent, particularly if you are overweight, have high blood pressure, or have a family history. Cholesterol and blood pressure should be checked regularly, as heart disease risk increases with age. By the time you reach your 50s, cancer screening becomes even more critical. Colonoscopy is recommended every 10 years, or more often if polyps are found or if you have a family history of colorectal cancer. Women should continue annual or biennial mammograms. Men may begin prostate cancer screening, which typically includes a discussion about the risks and benefits of a PSA blood test. Bone density testing is usually recommended for women starting at age 50, particularly after menopause, to assess osteoporosis risk. Annual hearing checks can help detect age-related hearing loss, and eye exams should include checks for cataracts and macular degeneration. In your 60s and beyond, the importance of screenings doesn't diminish. Many of the same tests from your 50s continue, but additional focus is given to maintaining quality of life. Lung cancer screening may be recommended for individuals with a significant history of smoking, generally using a low-dose CT scan. Bone density tests become more common for both women and men. Vaccinations also play a larger role. Older adults should receive the shingles vaccine, pneumococcal vaccine, and annual flu shots. Regular screenings for cognitive decline, including memory assessments and evaluations for early dementia, should also begin during this time. Balance and fall risk assessments may be included in routine care, given the increased risk of injury from falls. Preventive screenings are not one-size-fits-all. Factors like family history, lifestyle, and existing health conditions can influence which tests you need and how often. But by aligning your healthcare with age-specific guidelines, you dramatically improve your chances of catching serious conditions early. Staying current with your screenings, even when you feel fine, is one of the best decisions you can make for your long-term health and independence.